Okay, hi everyone, and welcome to today's webinar. I'm Sarah Brandspiegel. I'm an instructor at the Colorado School of Public Health, and I work with our Program for Injury Prevention, Education, and Research, also known as PIPER. And today's webinar is sponsored by the National Peer Learning Team on Child Maltreatment Prevention. We're a national network of people working in public health and social services and related organizations who come together to learn about primary prevention approaches to child maltreatment. And the NPLT is funded by the Centers for Disease Control and Prevention, and it's a partnership between PIPER and the Colorado Department of Public Health and Environment. And we're excited to host this series of research in progress webinars on preventing ACEs and child maltreatment. And the focus of today's webinar will be policy strategies for the prevention of multiple forms of violence against children and youth. And we're pleased to be hearing from Dr. Bart Klika of Prevent Child Abuse America. So I'll introduce him in just a moment after I get through some quick housekeeping. So first of all, please use the Q&A feature to ask any questions. You can enter your questions throughout the presentation, and then we'll have time at the end of the session to share those questions with Dr. Klika and hear his answers. But please share your questions as you think of them. Also, today's session is being recorded, and the link will be sent out after the session along with the slides. And we will also post those to our website. And please take a moment at the end when you close out of Zoom, a feedback survey will pop up. And please share your comments with us at the end of the session. Those are really helpful as we continue to plan future webinars to know what topics you'd like to be hearing about or any speakers you'd like to be hearing from in the future. I wanted to let you know that all of our past webinar recordings and slides are available on our website. I've listed here some of the more recent webinar topics that we've covered, and you can access all of those. I'll put the link in the chat for folks to go to see those. And our upcoming webinar happening next month, I would encourage you to register for this one. We'll be hearing from Dr. Philip Graham of RTI International, and he'll be sharing some information about their research study that's underway in Milwaukee, looking at the effectiveness of adverse community experiences and resilience and community organizing as a strategy for preventing youth violence and ACEs. So I hope you'll join us for that session as well. So now I'd like to introduce today's speaker. We're so happy to have you here today, Dr. Klika. He is the Chief Research Officer with Prevent Child Abuse America, and he's also research faculty at Florida State University College of Social Work. Prior to joining Prevent Child Abuse America, Dr. Klika was an assistant professor in the School of Social Work at the University of Montana. And his research examines the causes and consequences associated with child abuse and neglect, all with a goal of preventing its occurrence. Dr. Klika is on the National Board of Directors for the American Professional Society on the Abuse of Children and is the chair of the APSAC Prevention and Publications Committee, and is also the principal investigator of a CDC-funded grant looking at the effects of paid family leave and childcare supports in preventing multiple forms of violence. And that's what we have him here to share with us today. So welcome, and I will allow you to bring up your slides now and look forward to learning more about your work.
Great. Can you see my screen here?
Yep, looks good.
Okay, great. Well, thanks everyone for being here today. I'm Bart Klika. I'm the Chief Research Officer for the National Office of Prevent Child Abuse America. And as Sarah said, I'm here today to talk about some of our funded work. We're funded through the CDC for a 3-year grant looking at the effects specifically of paid family leave and childcare subsidies on preventing child maltreatment and intimate partner violence. Want to give the necessary statement that the comments I make today are my own and they do not represent the Centers for Disease Control and Prevention or the federal government. Now if I can get my slides, there we go. So just real briefly to talk about Prevent Child Abuse America, we're headquartered here in Chicago. And we do our work in multiple ways. We have chapters of our organization in nearly all 50 states who are doing work at a state level around the prevention, specifically the primary prevention of child abuse and neglect. We do work at both the federal and the state level around issues related to policies, specifically things like CAPTA, McV funding, and the sources of funding that are oftentimes used for the community-based prevention work that many of us do. We do work around public engagement and framing. You'll see my lapel pin of the pinwheel. In April every year, you'll see pinwheel displays. And that's really our national symbol of child abuse prevention. And we've done a fair amount of work too around the issue of framing and how it is that we talk about the issue of child maltreatment and trauma in general. And then finally, we also operate the evidence-based home visiting model, Healthy Families America. We have nearly 600 HFA sites across the country serving about 70,000 families a year. And before I jump into it, wanted to give a quick plug for our national conference, virtual conference coming up August 10th to the 12th. I put a link here just so everyone knows. I'm going to make my slides available. I will send them after the presentation. I've tried to embed links in the presentation, and so you can feel free to click on those links. But we're really excited to announce our keynote presenters. Day one is Dr. Nadine Burke-Harris. As many folks know, has been very influential as the Surgeon General of California and has been very involved in the ACEs movement. And so we're excited to get her take on efforts towards the prevention of adverse childhood experiences. Day two, we're excited to welcome Dr. Lizeth Rojas Flores, who's really going to talk about well-being of children with families with immigrant status, and really talking about the effects of sociostructural adversity on the well-being of families, but also children. And then rounding out our conference on day three, we're excited to have Vu Lei, who many folks know, writes on the blog, has a very prominent blog, but really is going to be talking about issues of social justice and equity, specifically for many of us who work in nonprofit sectors. So I would encourage all of you for 3 days of learning. Regular registration, I believe, is $150 for 3 days. And so we're very excited, hope to see you there. So the plan for today, going to do ever so quick overview of violence and strategies for prevention, really trying to set up why it is that we proposed our current project. We'll talk some about paid family leave and childcare subsidies specifically, and then I will talk about the aims of the current grant. We're about 6 to 8 months into the grant. We don't have analysis findings yet, and so I'll talk more about some of the planned analyses that we have. But then also really ending with some of the data that we have on COVID. So we presented one thing, COVID-19 hit, and it's causing us to reflect and change course in certain ways because data sources have changed. There's been an influx of things like funding, which are a great thing for community-based prevention work, but it's posing some evaluation challenges that I will highlight towards the end. So as many folks know, our child maltreatment data that we oftentimes use comes from the federal government through NCANS. NCANS collects data from state child welfare systems to get at a national estimate of annual child abuse and neglect. At any one point in time, we're about a year's lag. And so the most recent data that we have is from 2019. I give that as a caveat because this does not include the time during the pandemic. But what we know is in 2019, there were about 656,000 substantiated cases of abuse and neglect. And maybe not surprising to folks on this call today, but when we're talking to the general public, one of the things that really surprises folks is that a majority of those cases are substantiated for child neglect. When you look at state rates upward, there are some states where upwards of 90% of substantiated cases are due to child neglect. But for our national data, about 61% are due to child neglect, about 10% due to physical abuse, and fewer, about 7% for child sexual abuse. Deaths associated with child abuse and neglect, just over 1,800. in the year 2019. David Finkelhor and his colleagues have done a lot of work over the past 20, 30 years to track trends in child abuse, physical abuse, sexual abuse, and neglect over time. And what they've seen is that there have been declines in child physical abuse and child sexual abuse, but we haven't seen the same types of decline in child neglect. And as some have suggested, that neglect is so intertwined with poverty that one potential explanation for the lack of decline in child neglect is that neglect is so interspersed with poverty, and that until we do things to actually disentangle neglect and poverty and actually address poverty, that we likely won't realize the same declines in child neglect that we've seen in physical abuse and sexual abuse. A recent study came out by Dr. Emily Putnam Hornstein that looked at a birth cohort of kids in the state of California from the late 90s into the mid to around 2017 to understand engagement in the child welfare system. And I think that these findings are important for a number of reasons. First of all, it highlighted that nearly a quarter of kids are investigated for child maltreatment. But for our conversation today, and one of the key takeaways from this is that over half of Black and Native children had been investigated for allegations of child abuse and neglect before their 18th birthday. Over half. And so when we talk about issues of equity, as we talk about issues of disproportionality in child welfare, it's data like this that are critical to that conversation. Intimate partner violence, a lot of the data that we have on intimate partner violence, or IPV, comes from the National Intimate Partner and Sexual Violence Survey, or NISVIS. This is a nationally representative survey that's done to get at different forms of intimate partner violence, including sexual violence, physical violence, and forms like stalking. And these estimates suggest that anywhere between 1 in 4 women and 1 in 10 men report experiencing intimate partner violence. And we've known over time that intimate partner violence and child maltreatment have a fair amount of overlap. Estimates from the late 90s suggest that upwards of 40% overlap between IPV and child maltreatment. And some have referred to the overlap as the double whammy effect, that kids who experience IPV or witness IPV in the home are also experiencing maltreatment, which have the potential of compounding effects. And we know that intimate partner violence and child maltreatment share a similar risk or etiological profile. And so the Centers for Disease Control and Prevention and the Prevention Institute, a number of years back, put out a document called Connecting the Dots. And one of the benefits of this document is that what they do is they look at different forms of violence, and they look at the risk profile for each of those forms of violence. And what you really see when you dig into this, whether you're looking at the individual level risk factors, relational risk factors, community risk factors, or societal risk factors, is that many of these forms of violence share similar risk factors. And so I just circled one example here, looking at child maltreatment and intimate partner violence, and that is having weak or a lack of economic supportive policies for families is both a risk factor for child maltreatment and intimate partner violence. So as we think of our prevention strategies by addressing economic supports to families, we believe that we can reduce both of these forms of violence. The CDC over the last handful of years has also done a lot of work putting out what they call technical packages. And in these technical packages, they do comprehensive reviews of literature on different topics, and then make recommendations about what the science says about the most promising strategies and approaches to preventing these different forms of violence. So the three I highlight here is they have a specific one for child abuse and neglect. They have a specific one for preventing intimate partner violence, and a specific one for preventing adverse childhood experiences. But when you look across all of these technical packages and you look at what the CDC is recommending as some of the most promising strategies for violence prevention, the issue of economic supports to families, that is, family supportive policies in the workplace, increasing things like family income, these are being identified with the strongest evidence as strategies for the prevention of child abuse and neglect. Now, Carol and Sarah and Colleen were authors on this commentary. And, as part of their work, I found so much resonance in things that they had written about our need for a public health approach to the prevention of child abuse and neglect. And by public health, when we talk about public health at Prevent Child Abuse America, we use the Institute of Medicine's definition, which really is what we do collectively as a society to ensure the conditions in which all individuals can be healthy. And the important part of that definition, or important parts of that definition, are first the idea of collective. Our president and CEO oftentimes says the phrase that prevention happens in partnership. We realize that no one organization, entity, or model is going to prevent child abuse and neglect on its own. It really is going to take partnership amongst all of us to really make a dent in child abuse and neglect. The second component of that is around this idea of changing conditions. We need to change the conditions in which kids and families live. And we oftentimes do that through universal strategies, specifically looking at things like policies. And policies can include things like I'll talk about today, paid family leave, childcare subsidies, but also there's evidence starting to emerge on evidence for housing, evidence for earned income tax credit, as well as things like minimum wage. So there was a literature review done looking at studies assessing the economic insecurity in child maltreatment. And so what these researchers did is they looked at studies that allowed for assessment of temporal ordering, meaning that being able to look at whether or not we were able to implement a strategy prior to maltreatment occurring. And really what they found were things like income losses were associated with child maltreatment. The accumulation of material hardship also was a risk factor, as well as things like housing hardships. And so as we think of our strategies, our public health approaches, we need to be thinking of policy strategies that change the conditions for kids and families. There's also been a lot of work, or starting to be a lot of work done on earned income tax credits and their association with reductions in child maltreatment. And Joanne Clevens, when she was at the CDC, authored a piece looking at the earned income tax refundable version of the earned income tax credits and hospital admissions for abusive head trauma. And what they found is that the refundable version of the earned income tax credit was associated with reductions in hospital admissions for abusive head trauma. Interestingly, however, the non-refundable version was not associated with the same reductions. And so more evidence of increasing families' income as a strategy for child maltreatment prevention. And then the last one that I'll highlight before I jump into talking about paid family leave and childcare really is minimum wage. And Dr. Carrie Raytheon and Lindsay Bollinger, who also are on our current CDC project, did a study looking at minimum wage and found that for every dollar increase that we see in minimum wage, we see approximately a 10% reduction in reports for child neglect. And that effect was more pronounced for the younger kiddos and those of school age. And so why are we suggesting to look at these early child childhood policies like paid family leave and childcare subsidies. And I put these up here. These are great resources. Prenatal to 3 Policy Impact Center, Dr. Cynthia Osborne. If you haven't looked at some of their work, they're doing some fantastic work on creating state roadmaps around policy and strategies to track outcomes at a state level to really understand if we're moving the needle with both our policies and our strategies. And then the National Partnership for Women and Families, in collaboration with 0 to 3, put out another great piece, really talking about the importance of why we focus on strategies like paid family leave and making the child development case. But we know from our child maltreatment studies that it's the youngest kiddos that are at the highest risk. And so we talk about the perinatal period, the period just before and just after birth as a really stressful time for families. And that's a stressful time for many reasons. Just the change in routines that come about by having a new child. The financial strain that can be brought on by having a new child, not only paying for things like diapers, if you're paying for formula, but also in taking time away from work. As we'll talk about in a minute, the US does not have a paid leave policy. And so many families are having to decide between staying connected to the labor force or leaving the labor force to care for their kids, creating more stress on families. And then logistically, this is a time of significant challenges. Families who are making the decision to re-enter the labor force are having to make critical decisions about the care of their children. And we'll talk about some of the challenges faced by childcare in just a minute. But the stresses, like I said, there's these financial stresses of taking unpaid time away from work, which decreases income in a family, increases in expenses associated with having a new child, as well as the challenges of balancing a return to work and safe care for children. So like I said, the US currently lacks a federal paid leave program. There are many states who are starting to implement programs. I think if we have a moment in time where we have an opportunity for a federal option for paid family leave, it's likely now. There's a lot of great advocacy work being done at a federal level to have this placed in upcoming bills. There are advocacy days coming up around this, so I encourage all that are interested to get involved because it's an exciting time as we think about potential federal option for paid family leave to support families. What we currently have and have had for some period of time is the Family Medical Leave Act, or FMLA, which really provides unpaid job protection for some workers. And I say for some workers because FMLA does not apply to those working in businesses with fewer than 50 employees. And there are restrictions about being able to utilize FMLA based upon the number of hours that you have worked in the past year. And again, this is unpaid time off. And so while you might be able to step away from your job and have your job protected, especially for low-income families who might not have the cash reserves or might not be able to take an unpaid time away from work, this is not a viable option. And what our data suggests is about roughly 60% of workers are eligible for FMLA, but fewer can afford to actually take advantage of this benefit. In general, what we're talking about with paid family and medical leave is paid time away from your employment that would allow you to care for a newborn child, care for an ailing family member, or to take time away because due to your own illness or own medical issue. Now, there are debates about the expansiveness of the definition of who gets included in terms of who is considered family or what types of events would qualify. But really, I think there's big efforts at the federal level in any bill that would pass to have a very expansive view of who is included in family. We know that a very small percentage of US workers have access to paid leave through their employer. Less than half have access to paid personal medical leave. But when we see opinion polls about the general public, and so again, the National Partnership has done some public opinion work, and generally there's support from US voters about an option for paid family and medical leave for all. And so we see a lot of public support. There's actually a fair amount of bipartisan support for this idea. It's when you get into the details and the nuances of the policy where there starts to be some disagreements. Much of the work that's been done on paid family leave, looking at outcomes in the US, has been done in the state of California. There's much more work that has been done outside the US, but when we focus on studies that have happened in the US, much of it has come from the state of California, who implemented paid family leave. They enacted, I believe it was in 2002, but implemented in 2004. And what we've seen is that there's increased leave taking among parents of newborns, increased breastfeeding rates, improved mental health, and then also the quality of time that caregivers spend with their children, specifically around activities like reading. And for many on this call, you understand that the early childhood period, especially that perinatal period just after birth, is such a critical time for establishing attachment and bonding and supportive routines like safe sleep practices and breastfeeding. And so providing families with an opportunity to be present and not stressed about the economics of stepping away from work seems really critical as a strategy for prevention. So if you haven't already seen, I'm not going to click through all of this, but again, the National Partnership has put together what I think is one of the most comprehensive documents looking at the various states who have implemented paid family leave. I included the link here. I would encourage you to go to their site. But in this document, what they talk about are some of the nuances of how different states have implemented policy. It includes when the law was enacted, who is included in the definition of family, the percentage of wage replacement that is included, the number of weeks that are included, all the important sources of variability that I'll talk about in a minute that we are interested in understanding from a research perspective that may have a preventive effect are included in this document. So I would encourage you to look there. Again, another one of their documents, one of the questions that sometimes people ask are, why are people taking leave? So of the states who have implemented, do we know anything about how they're using their leave? And I just give the example of California. And what they find is that about a third of people are using this leave for the care of a newborn or a family member. And about 2/3 in the state of California are actually using it for their own sickness or ailment that they are taking care of with the leave. As far as violence outcomes, again, Joanne Clevens, when she was at the Centers for Disease Control and Prevention, looked at the implementation of paid family leave in the state of California and compared California to 7 states who had not implemented paid family leave. And what she found was that the implementation of paid family leave was associated with statistically significant reductions in hospital admissions for abusive head trauma for children under the ages of 1 and under the ages of 2. And the interesting part about this study too, and I don't want to get the stat wrong, but it was somewhere around only 37% of eligible families were actually taking advantage of this benefit. And so this is one of the studies that's often held up in the field when we talk about the potential preventive effects of policy strategies like paid family leave. But then, so maybe we can help families with some leave during that initial period right after the birth of a child. provide them with the opportunity for bonding. But in order to keep families connected to the labor force, and able to keep their earnings up and support their family financially, many families are placed in a precarious position of determining what they're going to do for the care of their child when they do return to work. And so that brings us to child care subsidies, which is a program of the Child Care Development Fund, started in the 90s, really focusing on keeping low-income families connected to the labor force. And those of you who have children or who have young children understand some of the challenges of childcare. First being cost. The cost of childcare has soared over the last number of years, with estimates suggesting that infant care per year costs in the ballpark of $12,000 or approximately $1,000 a month. And there's variation across states. I've seen some estimates of Mississippi being on the low end, states like Massachusetts being on the high end as far as what it costs. But what we know is that the cost of childcare is high, and it can represent a significant proportion of annual earnings when we look at families' income. Access can be another issue. Anecdotally, when we were looking for childcare after the birth of our first child, we were told that we were already probably a year late in looking, that we really needed to be thinking of childcare at the point we found out that my partner was pregnant, because access to many of these programs is limited, and access to high quality childcare is even more limited. And then the issue of reliability and flexibility of childcare. Many childcare centers are open somewhere in between the hours of 7 a.m. and 7 p.m. to accommodate what we would think of as traditional work schedules. But especially many low-income families have inconsistent work schedules, meaning they don't work the same times and the same days every single week, and may work outside of those quote unquote traditional hours of 7 a.m. to 7 p.m., posing significant challenges and forcing many families into informal childcare arrangements. And there's a lot of variability in how childcare subsidies are organized across states, which is one of the things that we're most interested in some of our work with the CDC grant, is understanding the variability across states and its association with various forms of violence. But states vary in their eligibility criteria, co-payment size, how much a family is responsible for paying on their own, if there's any exemptions. So for example, families with very low income, families with children with special health care needs, the purchasing power of the subsidy, how much does it allow you to get? Does it cover the cost of high quality center-based childcare in your state? As well as the work requirements necessary to remain eligible for the subsidy. And there's been some work. Dr. Katie McGuire-Jack, who also serves on our project with us, has done some of the work looking at childcare subsidies and child maltreatment specifically. But what we see are things like cost and instability associated with self-reported physical and psychological aggression. When parents have concerns about childcare, and that can be concerns about the cost, the flexibility or the quality of care that their children are receiving, those are associated with higher levels of neglect. And then finally, receipt of childcare subsidies has also been shown to be associated with decreased official reports of physical abuse and neglect, as well as self-reported supervisory neglect. As part of our initial work in the early stages of our grant, one of the things we proposed is doing some conceptual work to try to understand conceptually how is it that we think that childcare subsidies, and for the purpose of the paper that we're writing, we actually expand it to talk about early childhood and early education policy, which would include things like universal pre-K as well. How is it that we see those things associated with potential reductions in these multiple forms of violence? And so this gets a little bit at some of the mechanisms by which we think these policies may be associated with violence. This is definitely a work in progress, and would be happy to talk more about this during the Q&A. So the specific aims of our grant, really, we have 3 aims around paid family leave and 3 aims around childcare subsidies, and they largely mirror each other. The first aim is to really understand the effect of the policy on our violence outcomes. So paid family leave and child maltreatment, as well as intimate partner violence, and then childcare subsidies and the variability in childcare subsidies on the child maltreatment and intimate partner violence. Our second aim around both policy areas has to do whether we see any key subgroup effects. Some of the areas that we've talked about looking into are any racial or ethnic differences that we see, as well as any rural or urban differences that we may see in these. And then the effects of some of these, looking at the ways in which some of these operate and any potential mechanisms that we might see between the policy and the violence-related outcomes. So, for example, does paid family leave keep families engaged in the labor force, and increased earnings actually have a preventive effect on things like child maltreatment and intimate partner violence? So these are largely the aims of our grant over the next 3 years. Where we're currently at, we're finishing up our literature reviews, one specifically on paid family leave and the other on childcare subsidies and early education policy, looking at violence as the outcomes. And we're starting to clean our data to begin our analyses. So largely, I will say that's the work that we propose to do. And then what happened is 2021 hit. We submitted our proposal in February of 2020. As many folks know, as we entered into March and April of 2020, the COVID-19 pandemic started exerting a lot of impact on families and communities. We saw anecdotal reports of increased things like depression, hunger, job loss. During the same amount of time or same period of time, we saw increases in things like natural disasters as well that were affecting communities nationwide. And then the racial and civil unrest that we saw with the murders of George Floyd and so many other Black individuals over the past year and historically, that we saw families and communities under a lot of pressure. In addition, with many of the shelter in place orders that came down as a precaution for COVID-19, we saw families having to balance both work and childcaring responsibilities, specifically around working from home and providing remote learning opportunities, which all created stress for families. And so what I'm going to spend the remainder of time doing is reviewing some of the data that we have on how families were doing over the past year, and then really ending with some of the challenges that we're still trying to sort through with some of our grant work. So early on in the pandemic, Dr. Shauna Lee from the Parenting and Context Research Lab at the University of Michigan did some surveys of caregivers. Now, she conducted these surveys within 2 weeks of the formal shelter in place orders to really get a sense for how families were doing. And what they found was that even early on, within the first couple of weeks, families were already starting to worry about finances. They were starting to worry about things like social isolation. They were worried that their money was going to run out. They were starting to use things like yelling and shouting with their children, and were reporting them at higher rates than they had reported pre-pandemic. So not only did we see mounting stress for families, but we saw families engaging in practices that otherwise they had not engaged in, and that could be risks for child maltreatment. We also saw families, many early on schools had started to shut down. Parents were having to navigate a lot, and we saw parents reporting symptoms of depression, symptoms of anxiety, and using coping strategies like substance abuse or substance use to deal with some of their anxiety and feelings of depression. And many started reporting conflicts in relationships, that they were starting to have increases in conflicts in their relationships. So this is important because this was within a couple weeks of the pandemic. And here we're talking about being well into a year since these study findings have come out. And there's been others who have done studies across this time. Dr. Phil Fisher out of the University of Oregon, the Rapid EC project, during the initial stages of the pandemic, were conducting weekly surveys of caregivers to understand a number of different things about how families were doing. I only present one of their findings here to make the point that we oftentimes hear people say that we're all in this together, that we're all experiencing the pandemic in the same way. There was a minister on the East Coast that during the pandemic said, we all might be weathering the same storm, but we're weathering this storm in different boats. And I think that is so true when we look at a lot of our data, specifically here that looks at the impacts of COVID-19 on mental health for specifically low-income families. But when we look at data for Black and Hispanic families, when we look at data for women, and then the intersectionality of multiple identities and circumstances, we know that the effects of the pandemic have not been equally experienced by all. When we look at data on, and I'll talk in a minute about some of the data that we have from some national survey work, women are leaving the labor force, and this is creating a significant challenge that women are starting to leave, many of them reporting because of caregiving responsibilities of their children. And many of the gains that have been made over the past few decades are being suggested to being erased by much of what's happened as a result of the pandemic. In partnership with the American Academy of Pediatrics and the Centers for Disease Control and Prevention, we've been doing a series of surveys using the online panel survey company YouGov. And we have done so far 2 waves of surveys, really getting at the effects of COVID-19 and in what ways COVID-19 has impacted families, largely around things like employment and finances, and how that is associated with discipline and violence in the home. And so we've done 2 separate waves of surveys, 3,000 US adults in each survey. We're getting ready to go into the field with our 3rd wave, where we will also survey 3,000 US adults to understand the association between the effects of COVID-19 and discipline and violence in the home. What we found in our survey work is that upwards of 40% of those that we surveyed said that they had been negatively financially impacted by the COVID-19 crisis. About half of those that we surveyed had used some form of governmental resource, that could be SNAP, WIC, TANF, some other form of assistance as a result of COVID-19. And we see some of these same disparities in changes in employment between men and women. I think the statistic we use is 1 in 17 men and 1 in 6 women left the labor force, not because of their employer, but left employment on their own. And what we see is that for most of those who left the labor force, specifically women, they were leaving to care for a child between the age of 5 and 9 years old. And so that is, as we think about ages of kids, these are kids anywhere from kindergarten to about 3rd or 4th grade, who are a group of kiddos. These are that happen to be the ages of my kiddos, who needed a lot of help and support around remote learning. But we've seen this disparity in women leaving the labor force at higher rates than men. Experiences of schoolwork. One of the things that we like to point out from some of our survey work is that on the one hand, families reported that COVID-19 was stressful, that helping their kids with schoolwork was stressful. But we also saw of those families who also reported that it was stressful, many of them also reported that this experience brought them closer, that they had many positive experiences with their children. And I think that that's important to highlight because we've heard so much about the negative effects of COVID, but many families have been so resilient and been able to find new ways to connect with their children. Again, we asked about self-reported experiences of intimate partner violence. About 20% suggested that it was occurring currently, whereas another 20% said that it occurred in their lifetime, but not during COVID-19. When we look at some of our data on those who are reporting intimate partner violence in the home, we see a strong correlate is financial insecurity. Those with the lowest incomes are reporting the highest rates of intimate partner violence in the home. And when we look at the association between intimate partner violence and the use of spanking in the home, we've seen that for those who report IPV, about 60% are reporting spanking in the home versus only 14% of those who do not report IPV in the home. So again, when we look at the overlap between these multiple forms of violence, that's a critical factor. This is a report that we actually released just last week in October of 2020. Prevent Child Abuse America did a national survey looking at attitudes, beliefs, and behaviors associated with corporal punishment or spanking. And the finding that I'll highlight here is that one at the top. And that's that 42% of those that we surveyed, again, we surveyed about 3,000 individuals, about 42% of those in a caregiving role reported physical punishment in the last month. Now, this was in the context of COVID-19. These findings actually mirror a national declining trend over the past 20 years in the use of spanking and corporal punishment, but still we think remain awfully high. I'd be happy to get into the other findings during the Q&A, but that was the one that I wanted to highlight from that report. So COVID-19 and child abuse and neglect, we heard a lot early on in the pandemic about decreased reports to child welfare agencies for child abuse and neglect. And largely this was explained because of mandatory reporters not having access to children. And it was difficult to spot the signs of abuse. Teachers didn't get the same observation opportunities of observing kids on the playground or interacting with others or noticing changes in behavior. So the kiddo that leaves class and goes and sits in the bathroom, as well as just overhearing casual conversations. And recently there was an article published that looked at calls to the National Child Abuse Hotline, Child Help. And what they saw is they actually have seen over the past year increases in calls to the hotline, but also increases in utilization of their texting function as well. So we actually are starting to have some data about increased calls to national hotlines for concerns about child abuse and neglect. Again, when we look at the early stages of the pandemic, we saw increased rates in different parts of the country for reports of intimate partner violence. And again, this was in the early stages of the pandemic, but we saw increased reports in these cities of official intimate partner violence reports. So COVID-19 and child maltreatment, what we saw increased parental stress of many different ways, social isolation, as well as the fact that, as Carol and Sarah and Colleen noted in their commentary, we really lack a universal system of care and support for families in this country. And we don't necessarily have the federal options for things like paid family leave, which would provide a safety net for so many families. And so that's one of the things that we're hoping to tackle and provide additional evidence with some of this grant funding. Some of the things, before I open it up for questions here, that we're grappling with in some of our grant work is, on the one hand, I think it's fantastic that we've seen expansion or additional funding for programs like the Maternal Infant Early Childhood Home Visiting Program, CBCAP funding, which supports so much of our community-based prevention work nationally, as well as increased funding for childcare. But as we think about some of the aims of our grant, we're trying to parse through how it is that we isolate the effects of many of these policy strategies, knowing that there's really an influx of family supportive policies right now. So we're trying to work through that, as well as the fact that we're using NCAN's data as our primary source of child maltreatment outcome data. And we know that when the 2020 child maltreatment data become available, that they're going to be messy because we saw so much decrease in reports for child maltreatment. And so those are some of the things that we're trying to figure out with our grant right now. And I realized that I crammed about a day's worth of information into about the last 45 minutes, but I'm happy to open it up for questions.
Thank you so much for that presentation. Really important work that you're doing. I know doing it in the COVID environment, I can only imagine how challenging it is to do this type of research right now, but certainly it underscores the importance of what you're doing. And I'm very thankful that CDC is funding it and that you're taking on these questions. And thank you for sharing it with us today. We are getting some questions, and I'd encourage others to put your questions in the Q&A. And so the first one is related to the data you showed early on in your talk about the overrepresentation of people of color being investigated for abuse and neglect. And Stacy wants to know, why has that not changed over the years? And I would add to that question, do we know anything as we think about policy strategies that are more universal? Do we know anything about, or do you have any hypothesis about how that may impact different groups and the racial inequities that we can see in the child welfare system?
Well, I think it's a great question about why this hasn't changed over the last number of years. And I think over the past year that there's been more efforts in our child and family serving systems to really grapple with the issue of racial inequities, of engagement and navigation through the systems. And the one example that I would give is the Thriving Families, Safer Children work that's being done nationally. This is work that's being done. It's being led by Casey Family Programs, Annie E. Casey, Prevent Child Abuse America, and the Children's Bureau to support jurisdictions across the country to really reimagine child and family well-being systems. And there's two central components to that work. The first one is engagement of those with lived expertise in the design of the systems. So there's a big, strong focus on the idea of co-design, that is designing a system with the leaders and families and children who have been impacted and involved in the system. And the second component that's guiding that work is racial equity and forefronting the idea of racial equity at every single turn in the development of a child and family well-being system. And so that doesn't just mean that we're tinkering with a child welfare system or tinkering with policies within the child welfare system. It's really trying to reimagine a system outside of child welfare that provides families with an entry point into a system of care and support so they can get their needs met early on, oftentimes through light touch interventions, instead of having to enter child welfare. And like I said, the big focus of that is on racial equity and the idea of co-design, including families in the development of the system. And the hope is that strategies like this, and with the increased attention that jurisdictions and systems are having on racial equity right now, that we will not ignore this data any longer, and that we will work towards rectifying this.
Okay, thank you for that response. The next question comes from Anna, although I had the same question myself. How do we translate this research to legislators? How do you ensure that this type of research is getting to the policymakers, the decision makers who really do have the power to affect the way that our safety net system, our policies in this country are designed?
Mm-hmm. Well, I think it's a great question, and we get this question a lot. And we have developed, and I've provided a link to it, a toolkit for specifically the issue of paid family leave, which provides all sorts of resources that can be used as you think about talking to legislators, being able to write letters, to do advocacy work. But really, I think it's finding partnership in doing this. I think one of the challenges of our field is oftentimes we think that we have to do this work alone. There was a great webinar just yesterday by the Aspen Institute. The National Partnership was on that, and they're really leading a lot of the national advocacy work specifically on paid family leave. And I think that we have to find ways as organizations to collectively mobilize from a grassroots level to be able to talk about the benefits of paid family leave. And one of the things we hear from the legislative offices all the time are personal stories are really important. And when we talk about the issue of paid family leave, hearing from small businesses, what are the challenges that they experience on being able to have a policy like paid family leave and be able to provide for their workers, hearing from families who have benefited from paid family leave. And so making sure that we're not just throwing a bunch of data, but we're balancing some of that data with real life stories so they can understand the impacts of these. I also think the National Partnership has done a great job in helping us understand how different states have navigated the implementation of paid family leave. And I think being able to provide those legislators in states that may not have enacted it yet with example language, with examples of how other states have been able to do this is helpful. So they're not feeling like they have to start from square one.
Great, thank you. I guess I'd like to take a step back to thinking about, you laid out sort of a lot of the factors we're seeing with COVID. We did get a question on, perhaps with parents spending more time at home, might we see reductions in child sexual abuse and neglect? So, it's a very complex, very rapidly changing environment. And I wonder if you can reflect on that. And also, do you see the conversation changing around policy strategies as we grapple with the impact of the pandemic on families?
Great question. I think that there has been early on, there was concern, and we share the concern about children who were having to shelter in unsafe places, children and families. And we were definitely concerned about kids experiencing violence, families experiencing violence in the home. But we had that concern prior to the pandemic, that just because we know about the kids who come to attention of official authorities, not all kids come to the attention of official authorities. And so we share concern about the shelter in place and kids who were potentially being abused, physically abused, neglected, sexually abused in the home. But we also know, and I think some of our data was starting to highlight that from our AA work with the AAP, is that many families were finding opportunities to connect, and that was not equally experienced by all families. Essential workers did not have the opportunity to work from home. And so even in the heart of the pandemic, we're having to find childcare, find places for their kids. And so did not necessarily get to enjoy that experience of being at home with their children. But I do think we have to balance our concern with hope that many families were finding new ways, new opportunities to connect with their kids that they otherwise didn't have prior to COVID-19. And I think that COVID-19 has elevated the conversation about policy and the effects of policies. And we saw firsthand that the fact that we don't have a universal strategy for paid leave, for childcare, that very early on became a crisis for this country, with families having to balance caregiving responsibilities as well as their engagement in employment. And so I think it's elevated that. We've seen things like the child tax credits and the expansion of child tax credits, and those being an absolutely critical strategy for reducing poverty, but also reducing different forms of violence. So I think that the conversation is being elevated. And like I said, in many of these areas, there is bipartisan support, but when you get down to talking about the nuances and details, is where there starts to be differences of opinion of how to do it.
Well, thank you very much for laying this all out for us. I know we didn't get to all the questions, but I see Dr. Klika has his email listed here, so you can certainly reach out to him if you have additional questions. And please do join us at our July session, and we can continue.
I'm wondering, Sarah, are you there?
Are you there?
Oh, sorry, I lost.
Are you there?
Can you hear me?
Yeah, I can hear you. I don't know. I think that internet connection might be unstable. Oh,
Okay.
you there, Sarah?
Yes, sorry, I'm here.
Okay.
I'm back. Sorry, I think my internet did just cut out as I was
So did
wrapping
mine.
up. Well, thank you again, Bart, and thanks to everyone who joined us today for this conversation, and we look forward to continuing it.
Thanks for having me.
Okay.
Bye-bye.
Bye.